I know exactly how you're feeling. If you are new to this channel, my name is Talia, and I am your personal dental hygiene mentor. Have you been in dental hygiene clinic and have thought to yourself, this is not for me? Have you been in dental hygiene clinic, picked up an instrument and thought, I can't do this? Have you picked up an instrument and shaked your way out of a competency? Ladies and gentlemen, I am here to tell you guys that we are going to get through this together. Hang tight. Do not worry. I'm going to share with you tips that helped me through dental hygiene clinic and I know will help you through dental hygiene clinic. Down below, I will put in the timestamps of each tip that I'm going to share with you guys. Please go ahead and subscribe down below so I can create more dental hygiene videos for you guys and help you guys get through dental hygiene school. This is the cassette that I opened and will continue to open many, many times in my career, in my life, and so will you. Do not be discouraged by clinic. It sounds silly me telling you how to open up a bag, but you wanna, with your non-dominant hand, hold the bottom piece, and with your dominant hand, just pull back, and you can grab your cassette with your dominant hand and just slide it right onto your tray. So that's how I would open my cassette. First and foremost, I feel like posture is really important. Obviously, I'm filming in front of a camera, so I don't know if my posture looks funny, but this is me sitting straight. This is how I would actually sit if I was with a patient and had like a patient. But now I'm checking my posture. For me, posture is absolutely everything. You want to make sure that your patient's head and chin, their face, their body is exactly where you want it to be. Know exactly where you are seated in your chair and where you are on the clock facing your patient. That is key is actually sitting down in the right seating position. If you are sitting in the wrong seating position, you will notice that you won't have your fulcrum as stable as you want it. I'm going to grab I'm just gonna grab an anterior jaquette, okay? So, my posture to me is everything. You have great posture, you will be able to make sure that your fulcrum is literally pressing down. So, my biggest tip is your posture. You have great posture, you're good. And even people who don't have good posture, I'm not saying you need to have A1 posture. Like, I'm not saying that. What I'm trying to say is you want to be conscious of how you are seated on your chair. If you're not comfortable, it's like riding a bike or a motorcycle. If you're not comfortable on your chair, you're not going to be comfortable with your hand movements and just being able to give proper treatment and safe treatment. I have the pen grasp. I am literally fulcruming on the adjacent teeth of 24 and 25. You just want to really press. So I have my pen grasp and ideally I'm in position right now, but I just want to push down, right? I'm pushing down as hard as I can on those cusp tips of the teeth, on the buccal cusps. I am just pressing down and you are visualizing literally, I know this does not sound ideal, but you are literally like picturing you want to like take your patient's head off. I mean, I know that sounds insane. I know that sounds crazy. And no, you don't want to take your patient's head off. That's not what I'm saying. But picture just like you're really mad at something. Okay? You're really mad at something and you're just putting so much pressure. Okay, let's do this. You ever get a wax? I know, crazy. You get a wax, then they go right back and they press really hard so the pain can dissipate. That's what you're doing. I know that's a crazy analogy, but this comment is for my subby Gabrielle. Gabrielle, this is especially for you. Thank you so much for the request, by the way. Shout out to Gabrielle. I just want to say that your confidence in clinic starts obviously in your mind. It starts in your heart. This is something that you really, really want to do and accomplish. This is your passion. This is your career. This is your future. If you go into clinic and you are not confident, you're not sitting confident in your chair, you're not making your patient feel confident, your patient, let me tell you, they're going to feel more confident when you have insane amount of pressure and they feel like their jaw is secure. If they feel like you're shaking on their chin and you're just shaking and you're not, moving their chin and, you're kind of all over the place, your patient is not going to feel comfortable with you. So that is the main thing. You really, really, really want to put pressure on your ring finger, on your stabilizing finger, and put as much pressure on your patient as possible. Do not be scared. Your patient is not going to mind that you are putting this insane amount of pressure on their teeth. It's safe. You are protecting your patient by doing this. If you need to move your patient, you can move them gently. Please, can you please look away from me, turn towards me? Things like that to make your patient feel comfortable. So I feel like a lot of my classmates or just people that I've spoken to who have failed clinic or hasn't done great in clinic, it's just their lack of confidence, because this is something that they want, right? If you really, really want it, you can totally do it. You know what I'm saying? So definitely apply yourself mentally, apply yourself physically, and you will get there. Like me, for example, I just bought a skateboard, right? I have to practice on the skateboard. If I don't practice and if I don't put in my mind that I am going to ride a skateboard and be great at it, I'm not going to be great at it. I'm not going to ride a skateboard because I'm just going to be nervous. I'm going to be scared and I'm going to be shaky and I'm going to hurt myself, right? So that it's the same thing. Dental hygiene is very much like a sport. It's very competitive. It's, you can get injured. You can injure a patient. I know comparing it to a sport is not, it's obviously it's not a legal matter. Dental hygiene is obviously it's a liability. But what I'm trying to say is the clinical practice of dental hygiene is literally being confident by practicing what you are doing. It's a repetitive thing that you need to put in your mind and in your tactile senses, your motion, wave of motion, and you will get it. Practice makes perfect. If you are going into clinic discouraged, not wanting to do it, not thinking about posture, not thinking about the picture I gave you of wanting to, put so much pressure on your patient, if you're not putting these things in your mind, you are going to be in clinic every day discouraged. Don't feel bad if you fail in the very beginning of clinic. It does not, obviously going into dental hygiene in clinic, you're not going to be, the great master of dental hygiene. It just doesn't work like that. You have to go step by step, but practice makes, I don't believe in such thing as there's perfect. I mean, unless you're Derek Jeter. Practice makes perfect in the sense that, you keep practicing, you're going to get better. You keep telling yourself in your mind, I can do this. I am fearless. I am resilient. You are going to do this. And all those thoughts you need to put in that ring finger while you're fulcruming. And I guarantee you, you will be great in clinic. Another great tip is you need to exercise your hands. So obviously in the very beginning of dental hygiene, you are going to feel like this is new to you. And it is. It's going to be, everything brand new. You're going to feel like, uncomfortable. You're going to feel like your hands are doing things that your mind has never processed and never thought it would do. So what you need to do is invest in one of these guys. When I first started dental hygiene school, they gave us one with the college name, but definitely invest in these guys. You can get them on Amazon for cheap, of course. I love Amazon. While you're studying or while you're driving, not when you're driving, but when you're having lunch or a snack or you're watching TV, definitely, you want to exercise your fingers, your hands, your muscles, and you want to make sure that you are getting that strength, because if you're not doing this, guess what? Your fulcrum is going to be weak, your hands are going to hurt, and your fingers will give out while you're working on your patients. So definitely invest in one of these guys. And you'll notice that your hands will definitely get stronger and you will feel a lot more confident with the power in your hands. My third tip is definitely talk to your teachers, talk to your mentors, talk to your professors. They are there to help you. My college was just so wonderful. I just have nothing but good things to say about the instructors, the adjunct professors, the professors. They are just so helpful. They want you to pass. And I know it's the same in your program. This is a beautiful profession to be in. We are all community. We are a family. We are a team. Yes, you have to stay professional. Obviously, professionalism is the number one thing, but make sure that if you're having an off day in clinic or a bad day in clinic or you're feeling discouraged, go for those hours, sign up for those hours of extra help and speak to your teachers. Tell them, hey, I feel like I'm not getting it. I can't, the Explorer, I had trouble with it. I feel really funny on position number 9. I'm having trouble with the third quadrant or third sextant. I don't know what I'm doing. Straight up. It's okay. You ever heard every clinician has a bad day or every person has a bad day? No clinician's perfect. No person is perfect. Obviously, we are doing this for a living. We should be the best, the greatest, but nobody is perfect, especially as a student. That's why we're students, right? Because we're learning, we're in the learning process. So speak to your instructors, let them know what's going on, let them know how you're feeling, let them know. I'm sure they already know what your weaknesses are, but when you are interacting with them and talking to them and telling them, hey, I want the extra help, they see that and they're like, wow, there's potential with you, right? It's very hard as a teacher to teach a student who's not willing to learn, and it's also hard for a teacher to teach a student who thinks that they already got everything in the bag, and that's not the case. That's why we're students. My third tip is definitely speak to your instructors and let them know how you're feeling. Tip number 4, do not feel discouraged, okay? Do not get discouraged. Even if you're having an off day, if you're having a bad day, do not get discouraged, guys. This is something that comes with experience. It's something that comes with time. So definitely take your typodont while you're at home and grab your instrument and literally, I closed my cassette. Grab your instrument, grab your typodont, and sit there, put the pressure, get in there, really, fulcrum. Think in your head, like, I am going to take this typodont's chin off, and that's how you're going to get it. Go home, you had a bad day, take the time off from the typodont and clinic and just focus on books. That's what I did. I tried to balance as much as I possibly could in dental hygiene school because clinic and bookwork is just so, they have their strengths. Like, I had my strengths and my weaknesses in both. So I tried to balance as much as I possibly could. And clinic can be challenging, especially in the first year. Clinic can be very challenging, and I had friends who would come to me and tell me, how do you like clinic so much? I'm just a hands-on person. I love the arts. I love painting. I love all that stuff where I move my hands. And a lot of my friends had some difficulty. They had some trouble. And, I would literally go home and grab my typodont and put that pressure on the fulcrum. Like, I'm sure your instructors, while you're in clinic, walk around and see how you're fulcruming. Take their advice. Listen to their advice. Do not get discouraged. Grab your typodont when you go home and practice at home. It is key to practice, practice, practice. Tip number 5, open your book. Flip through the pages. Look at those. I don't know if you guys have the patient tutorials book in dental hygiene. I forgot the name of the book, but I'll plug it down below for you guys. There's like modules in these books, and there's just so many resources in your textbooks that you guys don't have any idea. And I'm a dental hygiene graduate, and there's probably modules that I still haven't looked at. There's just so much information on clinic in your actual textbooks that you guys probably have no idea exists. So definitely go in your textbooks, and whatever chapter that you're working on in clinic, make sure you go back and follow those modules, because they are very, very helpful. Some people are visual learners. Some people are hands-on learners. I'm more of a hands-on person. Like, give me something and I'm watching you. I can do it. That's the way I learn. Everyone learns differently. And there's a lot of people in dental hygiene school who are straight A students in their bookwork. And then when it comes to clinic, they just completely fall off. And that's what it is. You have to train. It's like when you do a sport. I played a lot of sports, so I know what that's like. For you, if you played sports or grew up in like recreational things or activities, things like that, you know that you practice, you like the movements, you have to keep practicing. So that is another tip that I will give to you guys is if you are not a hands-on type of person, or you feel like you're struggling when it comes to physicality, go into your modules. It'll give you like 2 pictures. So there's a green check mark that this is the way you're supposed to be holding an instrument, and then there's a red X that says this is not what you should be doing. Here I go, opening up my cassette again. So let's say I'm working on tooth number 30. I remember the Explorer, like I didn't know what side, and then you just get it. And the day that I picked up my Explorer and I put it right to the tooth, and I was like, oh my God, I did this. And it comes with repetition. It comes with practice. Practice. Grab your typodont and literally sit there and fulcrum. And I guarantee you guys, you will get there. You will get it. Honestly, the more you keep telling yourself, I want this. I want to be a dental hygienist. I am going to kick clinic's butt. You will, let me tell you, don't get me started, you guys. I love my class so much, class of 2020, my girls, and shout out to you guys if you guys have a great class. My class, it's amazing. Even me, the struggles that we went through together, you just see, it's like a butterfly, we blossomed and we did it. And now we pick up instruments and it's cake for us, and we're not the best clinicians, but we are the best that we can give to our patients because it's all in here and it's all in here. And we practiced in dental hygiene school and we worked our behinds off. So I just want to encourage you guys, if you failed dental hygiene clinic or you have been discouraged because you shake, you're not getting the fulcrum, you're not getting this, you're not getting that. This is what you keep telling yourself. Family, your resources are there. Use them. Use your resources. Continue to motivate yourself. Continue to surround yourself with people who are having the same struggles, but also who you can benefit from and have help you. Hope these tips you take with you and you just feel better. Shake it off. Tomorrow's a new day. Grab your typodont. Grab your little stress ball and practice. Grab your instrument and practice. Go for a walk. Things that I did when I would have a bad day in clinic, I would go for a walk. After school, I would go for a walk. I would grab my typodont. After my walk, grab my instrument and practice. And honestly, if I was just not feeling it, I would grab a book, study another subject. Next day, start over. That's what you gotta do. Stop telling yourself that you can't do it, because you can. It's practice, it's like a sport, and you will get there. If you like this video, give it a thumbs up. If you're not subscribed to the channel, please subscribe if you wanna see more dental hygiene videos. The way I can create content for you guys and mentor you guys with dental hygiene is if you guys just drop down suggestions below, and I would be more than happy to mentor you, put some content out there for you guys. I love dental hygiene so much, and I love you guys so much. So please join the family, and thank you guys for watching. Hang in there and follow me up on your journey. Until next time, I will see you guys in my next video.